All right,
Okay,
you're set.
all right. I think we have a quorum. We're just waiting for Mike, Video, and Ryan. We haven't heard from either of them, but hopefully they'll be joining us. I'd like to get the meeting started. We could get an approval for the minutes of November 8th. Someone would like to move those minutes.
Move, Nightingale.
Okay.
I'll second it, Mark.
All right, thank you very much. All in favor?
Aye.
All right. We do have, before we get to a presentation from Monica Salvage, we do have one appointment to the Board of Health. Dr. John Kozachoff is a renewing member. So I entertain a motion to keep Dr. Kozachoff on the Board of Health. Can I get a motion for
You
that
said that
appointment?
name one more time.
Kozachoff,
Thank you.
I'll move it.
okay, second?
Nightingale.
All right, great. He's a great addition to the Board of Health. So all in favor?
Aye.
All right. Tonight, I had sent around some information to committee members in regards to a funding proposal that was developed by Monica Salvage, and basically asking for a one-time ARP gap funding proposal, which really, and she'll go over this, is not necessarily the continuation of the Healing Communities research study, but really transitioning the initiative to Cayuga County Substance Use Prevention, Education, and Response Team, and keeping the momentum that we have in this community going, and expanding it away from opioids, but to deal with all substances, because we're still continuing to see a significant issue in this community. And if there's consideration for this type of funding, this would show an investment being made by the county to continue the work, and especially to continue the coordination of the work and address the needs coming forward in this community. So with that, I will ask Monica to give a presentation about this proposal. And you have an opportunity to ask questions or get additional information.
Madam Chair, before she starts, there's some new members of the ledge that are here, Monica. Is there any chance you could maybe just give a little thumbnail thing as to how we've been researching and coming up with some ideas of maybe stem the overdose?
Yes, so I was planning on giving a quick overview of what we've been doing in the last year and a half, 2 years, and then what we're proposing to transitioning into. If that's okay. Great, thank you, Max. So thank you for having me here and having discussed with you the proposal for a comprehensive approach for substance use in Cayuga County. Next slide, please. I'm going to start my presentation with an empty slide, because that's how I felt about 2 years ago when I took over this position as the project director for the Healing Community Study. It was brand new project that came to the county. And if you would have asked me 2 years ago what the overdose situation in Cayuga County was at the time, that's probably as much as I could have told you at the time. I knew it was bad. I heard it was bad. We got selected to participate in the Healing Community Study because it was bad in Cayuga County. But we really didn't have a good grasp of how bad and what was really happening. And it wasn't because there was no data. There was data available from the state level, but that was 2 years ago, 2 years lagged. That didn't really help us in terms of real-time response. And then there was data available from local agencies individually, what they were collecting. But again, it wasn't in a format where it would help us figure out what's going on the countywide level and how we could make decisions based on that. Next slide. So over the last 2 years, a lot has happened, and what we were able to do was build a team for Healing Communities study that addressed the opioid epidemic here in Cayuga County. And it was really building an infrastructure for a countywide opioid response. And it wasn't so much the direct services like other agencies are providing, it was more the coordination and collaboration among all those efforts that were already happening, and figuring out how do we get everybody to work together, figuring out how we can collect data and analyze that data that really helps us understand what the trends are in our county regarding opioid use, and then how can we make decisions to address those. So we put together a local steering committee of stakeholders, and they were guiding basically our efforts in addressing the opioid epidemic. We put together an action plan with strategies of how we thought we might best address those issues in Cayuga County. And then hand in hand with that, how can we work with our partners to help them collect data and use that data in a way that will help us make informed decisions as opposed to just going by anecdotes and what people will tell you. We also have somebody on our team, our epidemiologist, who really took the data collection and analysis effort to the next level. We have data now like we've never had before, and I only show you a couple things, but it's really intricate and it's really helpful in making decisions. And also presenting stuff to the public, because it's not just us who should know what's going on, it should really be the community who's most affected. So we launched several public information campaigns that address the stigma around opioid use disorder, how people can help their loved ones when they're struggling, that it's okay to reach out, you don't have to suffer alone. What people can do in terms of when they're ready to seek help, where those services are in our community and what's available to them. So all that information went out along with the data that we collected along the way. And then we have two really valuable team members who, on the one hand, are really knowledgeable about this community, about the recovery community in Cayuga County, about all the services that are available and how to access them. And on the other hand, somebody who's worked with healthcare systems on the county, state, and national level to help them move into the direction that better helps the needs of the patients and really help implement change in those organizations. So with all that, we built the infrastructure to really address the issue, and then we worked with our partners on strategies in the middle of the pandemic, because we started in January and the pandemic reached Cayuga County in March. So we had to figure out creative ways to get Narcan out, which can save a person's life when they're overdosing on opioids. We wanted to connect to people who have recently overdosed because we wanted to help them get linked to services and to treatment. And so we found through our collaboration and through our research of the system as it was, that we had some gaps and that we had some difficulties in accessing different treatment paths. And also that those accesses are timely, because there's a very small window when people are ready to seek help, that you can get them the help, because it doesn't help 2 weeks down the road, or sometimes even 3 days down the road. Sometimes it has to be that day. And in Cayuga County, we didn't, and still don't really have that capacity to address that. So we partnered with the prescriber who was on call for us and still is, to provide that same day access to start medication treatment, for instance, if somebody really needs it that day. That's something we have not had before. And then we're also working with the hospital in the ER, because people present with overdoses there. And it's really important that that recovery journey can start already there, with providing medications there at the ER and then connecting people to treatment providers in the community for ongoing care. We've also worked intensely with Mixed Ride for Friends, the local peer organization. We see peer work as a critical part of the recovery of a person. Peers are people who have lived experience. They have had substance use issues themselves before and then are trained to help people in their journey through recovery. And so we've worked extensively with Mixed Ride through their organizational challenges, through their staff turnover challenges, to really help them become that next level from the grassroots organization up to a really organizational functional partner to document the work that they're doing making policies of how they do stuff. All that stuff doesn't happen in a vacuum, and it doesn't happen by itself. So our team was essentially helping all partners that we've been working with through the changes that we were all agreeing upon together. So, and we felt that the overdose situation was so dire that we needed to form an overdose task force to really look at high-risk cases and what's happening there in their history and how we can help them not fall through the cracks and hopefully not overdose again. We're looking at people who overdosed multiple times. And it's a very small group of people from first responder agencies, people who are actually directly interfacing with people who have overdosed, who know them, and figuring out what their situation is, what their common background is, and how we can help them specifically. Next slide. So if you ask me now what the overdose situation is in Cayuga County, I could talk to you about that for an hour, which I won't. But we have a lot of data now, and those are only just a few data points here, but the sad reality is that we went from bad to worse. Due to the pandemic, due to a lot of other things that happened during the pandemic that impacted people with opioid use or substance use disorder just as well, bless you. So we have way surpassed our overdoses from last year. Already this year, we have a month to go. We're at 258. That's all overdoses of all substances that have been recorded. That's about 23 overdoses a month. That's about almost every day somebody overdoses somewhere on something in this county. A third of those overdoses are suspected to involve opioids. That's the focus. Opioids is the focus of the healing community study. But that leaves 2/3 of overdoses that are currently unaddressed because it involves other substances that are not opioid related. And the one silver lining in all this is that while the overall number of overdoses has increased since last year, fewer people have died in Cayuga County. So we've lost 15 lives this year so far. Last year, we had 21 fatalities. So this is only a snapshot of, what data that we're collecting regarding overdoses, but we get this on a monthly basis and we talk about it all the time. We utilize this data. We look at trends over time. That's why you see the long bar graph at the bottom. We look at averages. We look at all those things on a weekly basis, even to figure out, what else we could do. Next slide, please. So just one example of how to develop a strategy and then track it and then figure out what the outcomes and what the impact was. The first thing when everything shut down last year in March was people did not have access to Narcan, and we were really frightened that people were just going to die left and right, just because there was no opportunity for people to get that life-saving medication. And so we worked really fast in different ways to meet people where they are. So we created an online platform on the county website, cayugacounty.us/Narcan, where people could go to request Narcan, and we would mail it to their homes. We're mailing Narcan throughout the county into the remotest areas where we would never reach them before. But we also went out into the neighborhoods and into the towns and villages where overdoses were happening during the pandemic. And we were training people there and we were distributing Narcan there. Our jail has trained almost 300 inmates and sent them home with Narcan when they're being released. That has not happened before. And we're also putting out red boxes, the metal boxes that you see here in the county office building, but also in other places, public places around the county. And we've placed about 119 kits so far. So overall, we've distributed in just 19 months, almost 1,600 Narcan kits. As a comparison, in 2019, we distributed 136. So again, that's a big number, but how do we know that it really gets to the right people and that the Narcan is actually being used and is not just expiring somewhere in a desk drawer? Next slide, please. From a different data source, we see who administers the first Narcan at the scene of an overdose. And if you look at all the bluish, purplish bars, those are the numbers of overdose witnesses who administered Narcan at the scene. We started our initiative in May. So prior to May, there was almost no bystander Narcan administration. So people had to depend on the first responders coming in time to save their lives. So from May, June on, you can see every month a steady number of overdose witnesses who were already there, had Narcan and used it before first responders showed up. So thereby potentially saving 60, 70 people with having Narcan on top of all the people that were saved by first responders. So that's how we know that the Narcan is getting into the right hands, that it's being used, and that this strategy is also effective. Next slide. So in essence, we've been operating during two public health crises. In 2020, Cayuga County lost almost as many people to overdoses as to COVID-19. And the data suggests that it was a really bad year for overdoses, that our interventions have prevented additional deaths. So obviously this is not just happening in Cayuga County, it's happening nationally. And you may have seen some recent headlines of record numbers of drug overdose fatalities. We're now at over 100,000 in a 12-month period. The last record was 93,000. So it's steadily increasing. And what you also hear is that it's fueled by a synthetic opioid called fentanyl. What makes fentanyl so dangerous is not just that it's much more potent and much more deadly than heroin or any other substances for that matter. It's that it's being mixed with almost any other substance that you can find on the street right now. So what that means is we're not just dealing with people anymore who are addicted to opioids and we're trying to get them help, which is a very specific response, you might say, because you tailor that to that one specific substance. Now we're seeing people using drugs recreationally and they end up in the hospital and they don't know what hit them because fentanyl was in their drug supply and they didn't know it. So besides heroin, we've seen reports where fentanyl was mixed into cocaine, it was mixed into fake pills that you can buy on the street, and most recently even in marijuana. So that requires a much different response than what we've been previously doing when we were mainly focused on opioids. Next slide, please. So polysubstance use is an issue, and it's been an issue, and it's been increasing. And that's what the data is showing. The CDC data that you see here, that in 2019, 50% of all drug overdose deaths involved multiple drugs. That's 2 years ago. I can tell you now, in 2021 in Cayuga County, 83% of our fatal overdoses involve multiple substances, and almost all of them involve fentanyl. So only a few actually involve heroin. So that by itself, again, shows when we look at the data, when we look at the substances that are involved, that we need to have a much broader focus and a much broader approach to this. Next slide. So what we are proposing is a countywide substance use prevention, education, and response team. And what would that do is basically using the infrastructure that we've built for the Healing Community Study with the team, with the steering committee of local stakeholders that we're working with the partners, and the same framework that we've basically been applying to opioids, and expand it to a more comprehensive approach that includes other substances as data suggests, as they evolve, as they arise, based on the trends that we're seeing. And again, why is it important? Because that's what we're seeing. And again, here's the data that I just referred to before. That's what we're seeing in fatal overdoses. That's what we're seeing in non-fatal overdoses. It's just a multitude of substances that are involved that we really haven't been focusing on so much. Next slide. And so what we're proposing is here on the left side, in the purplish shaded area, you see all the things that we've been doing with regards to opioids. So it was our opioid response coordination, the data surveillance, data collection, Narcan distribution, the linkage to treatment, medication for opioid use disorder, public information campaigns. All those things we will propose to have that expanded team provide, because opioids are still a problem. I'm not trying to say don't focus on opioids anymore. We definitely need to. But in addition to all the focus that we've been providing on opioids, we're proposing to expand strategies to other substances that become a problem. And another issue that we wanted to add was substance use prevention. Because two limitations of the healing community study were that there was no focus on prevention. It was only treatment when people were already having the disorder. And there was no particular focus on youth. And so with that comprehensive team, we really want to focus on youth and prevention across the whole lifespan of a person, because we feel that this is the only way that we can get a handle on this. Next slide. So who would be doing that? Again, when I talked about our current team, we have 2 full-time staff and 2 part-time contracted consultants. And what that does is we really were able to build a team that combines all the necessary expertise to translate what we've learned and what we've done in the opioid area to other substances. We have extensive background on substance use disorder and project management, communications, peer advocacy work, community outreach, data analysis, how to facilitate changes in organization, and how to access and navigate our local services. All those things are already here. And although some of those people are contractors, they really work for the county. They work for the county's residents, and that expertise that they've brought here, we'd really like to keep here, because epidemiologists don't grow on trees. So they don't come by easy, and having that expertise here just really transformed our ability to collect and read and analyze data like we've never had before. And so you may say, well, that's all nice, but why would why would we fund the coordination of all those services? Can we just put more money towards the services themselves, towards the agencies that provide these direct services? And that's a valid point. That's a valid question. The response would be that our team is not a competition to those service providers. If anything, we're working hand in hand, because the service providers are doing good work on their own, and they get funding for their programming. So it's not that their funding is in jeopardy by any means, and there will be more funding for their programs coming down the pipe. But doing things in isolation, even if you do them well, is not always that helpful, because that creates gap, that creates inefficiencies and duplication of services. So that overall coordination and working together on those services has really helped us in the opioid area, and we feel that it can help us with other substances as well. Next slide. And how are we going to do that? Again, we would apply what we found through the opioid study, all the data, all the stuff that we collected, which was not just on opioids, it wasn't all sorts of substances, but we were focusing on opioids. Use all the findings that we have from that effort and expand it beyond to other substances. Again, in collaboration with the agencies, working with the local steering committee, and developing this really countywide approach and response. Next slide, please. So what's the ask? The ask is a one-time ARPA fund allocation to institutionalize this new team, basically transition from the opioid focus over to making a plan for the comprehensive substance use response team. Until other funding opportunities that are coming down from different state levels and and federal levels until they are a little bit more finalized, because right now there's a lot of things up in the air, and until that can be analyzed and what we can access for that particular purpose. So I want to stress that we're not asking the county to just continue the grant funding that we previously had through the county budget. It would be a one-time allocation. And again, what we're asking for, we may not need all the money, and we may not need it for the full period of time, depending on when other funding becomes available. But it would secure that the team's expertise stays with this county and people don't start looking for other jobs. And it would also keep the control with the county and not on a grant funder who says you have to do this, this, and this. And again, the funding proposal also includes money for the agencies for new initiatives that go hand in hand with the bigger plan that we're developing with them together. Next slide. So what we're proposing is for an 18-month period, an investment of up to $500,000 from the ARPA funds, which falls clearly into the bucket of public health response and addressing populations where COVID has had a negative impact. And I think we can all agree that people with substance use disorder have been disproportionately affected by COVID. Again, to retain the expertise in the county, to support the service agencies until future funding sources become available. And so here you have our funding timeline for your understanding. So we are right now in the implementation phase until June. So that's where we still have full funding through the Healing Community Study. Starting July, there will be no funding for service agencies anymore. That's going to be gone. And then our staffing funding is going to be greatly reduced because we're going to go down to 1.5 staff people in our team, because it's basically that time frame to close out the grant, to do some reporting and whatnot. And then the grant is finally over in March of 2023. We are asking for that time period when the funding is going to be greatly reduced from July 2022 until the end of December 2023, $250,000 to keep the staff expertise here. And then up to $250,000 for initiatives that our service agencies are proposing. So again, this is up to new initiatives for our community partners that may or may not be funded depending on what they're coming forward with. So again, that's why I'd like to call it an allocation, because we're not asking for the whole amount and then do with it whatever. It will be based on a reimbursement. So whatever is being used, wherever you keep your ARPA funds, it will be reimbursed from there as expenses are happening. So if nothing is being used from this bucket, then this will not be touched. If other funding becomes available sooner, sometime earlier in 2023, we will not be asking to fund until the end of 2023. And if no funding becomes available at all at the end of 2023, then that's it.
Thank you. Can we get some questions from Monica? That was very good, Monica. Thank you.
Thank you.
Heidi? Jim?
How many partner agencies and stakeholders have worked with the study?
Wait, 20 plus. We have about 20 people on our steering committee, and they're from different agencies, law enforcement, treatment providers, education systems, people with lived experience. Yeah, a number. And then, not everybody who's on the steering committee, there are other partners that we have that are not on the steering committee. So again, the funding that was provided through Healing, again, it was not operational where we just gave money to agencies and say, run with it and good job. It was really focused on the strategies that we're implementing together and for which agency does it make the most sense to do that implementation. And then that's how funding was allocated.
And Monica, as new information comes forward, if you continue this work, the pot of money that's there for movement to community-based organizations, you kind of would be a little bit of a gatekeeper of that, but you would be assured that agencies could come forward if the county makes this investment and get some additional funding to do some of the work that's specific to addressing the needs that you're finding. That's sort of why it's a two-pronged thing. You have staffing funds, and then you have this other amount of money that is discretionary that can be used to address the needs that.
Right. And that may be, again, if it's a new initiative, that may be something that's not covered by other program funding that the agency currently has. But it may be totally in line with what we are trying to do here in the county and what we see based on the data and everything else, that this is a need and this agency could fill that need, but they may not have funding currently to do that. So that could help provide seed funding to start that initiative, again, track it and see if it's impactful. And then if it is, they could look for other ways of how they could fund it long term.
And we pushed out like a little over $500,000 to community partners in the first 18 months of the initiative. The county's role is very important in this because it's the local government unit's responsibility to coordinate mental hygiene services.
Can you guys hear that? Can you guys hear online?
No, can't hear.
You're gonna say it, you might as well. Yeah, you're gonna go say it, you might as well say it to the owl,
He's
yeah.
under stage.
Can you guys hear now over there?
Yeah, that's better.
Okay, so I was just saying, like, we had pushed out a little over $500,000 to community agencies in the first 18 months of this intervention. And the county's role in being the coordinator of the services is really important because it's a local government function managing the system. So it's not just about funding stuff, it's about making sure that it's integrated and it's working towards, pathways for care that are going to be sustainable and all of that. And this work, I'll talk. If we had this sort of focus 6 or 7 years ago, this ability to focus the way that we've been able to focus with these guys, this team, which is an incredible team that's working here on behalf of county residents, we'd have been in a much better place with reducing overdoses and overdose deaths. If this stops, it'll never start again that way. There's no way it could. So this is we think it's a very reasonable investment, and it's important to save people's lives. So.
Raymond, stay right there. Can I?
Go ahead.
Ray, would you just touch on the cost avoidance? I mean, it looks like a big number, 500,000, but when you put a kid into Pins or Harriet Tubman's house out on Pine Road, when you put those kids in Cayuga Home for Children, and the cost of housing one of those kids because they've maybe gone down the wrong road, the expense to homelessness, and so it's a cost avoidance thing that I see in this thing.
So this epidemic has been the largest single driver of removing kids from their families for abuse and neglect, who end up in all levels of foster care, which is very expensive. Much of the people who are homeless become homeless, and we have to motel, substance abuse issues. People lose everything, crime to support the habit. There's a cost, they go to jail. The hospital emergency room costs, multiple overdoses, people apparently you pay that in Medicaid and insurance premiums. So it's a big, I think you have to sometimes be intuitive about this stuff. If you look at all of these potential bad outcomes, every one of the people that got medication assisted treatment immediately are no longer doing that stuff. They're able to
Revolving door.
Yeah, we're able to work with them to stabilize the families. They end up more likely to be employed and get out of emergency housing, and their health outcomes improve. And you're right, it's a lot of money that gets spent on this. It's insane. And then on top of that, people die, which we all, probably everybody in this room knows someone that this is the family that this has affected. So I think this is a great opportunity and hope that you guys can support this.
If you could just talk about like one child who goes through the system, it's $1 million, isn't it?
So we take 3 kids from a family and they're in foster care for, well, Christine, 18 months sometimes. They go to a residential facility, it can be $150,000 a year. It's $750,000 over 3 years. And, you know, they may not even be able to go home, you know, because this is such a terrible disease that it alters people's brain chemistry in a way that it takes like a good year and a half of not using anymore for their head to clear. And even then, it doesn't always work the same way. So this is the biggest driver of removals that we have. This follow up quickly by domestic violence, with sort of related to it anyways as well too. It's just awful things that happen in families. So, yeah, you're gonna save a lot of money. You have to believe you're gonna save a lot of money and make lives better for people who live here, who are our neighbors, cousins and friends.
Trish, do you have a, Ned Keith, Trish and Ned Keith?
Thank you. Thanks, Monica, for your presentation. Sorry I'm not there in person to hear it. I had a meeting right up until this one. But I definitely appreciate the work that Healing Communities been doing during the pandemic. And I appreciate the data you've collected to be able to show us some of the outcomes. Regarding moving forward and expanding the scope of work of the committee, I was wondering if you could talk a little bit more about the mental health piece. I know it looks like you're going to be collecting mental health data, suicide data. I mean, that's we've lost a lot of people in our county to suicide as well. And I was just wondering how much more of a focus or will you be able to place on that mental health piece moving forward? And will the community-based intervention strategies be able to fund some of that work, whether it's new treatment programs or whatever needs are identified through your work, addressing gaps that we currently.
Thanks, Trish. Yeah, that's a really good question and a really good point, because just like there is not just one substance usually involved when people deal with substance use disorder, it's also not just one issue that drives them there. So especially when we look through the overdose task force, when we look at cases specifically, there is always a myriad of things in people's lives that contribute or started or perpetuates the substance use disorder. And co-occurrence of mental health and substance use disorder happens quite a lot and is very frequent. So you've mentioned the suicide data. I mean, it was through our efforts when we looked at all the overdoses month after month, where it shows if it's, you know, what substance is involved, and also if it was intentional or if it was accidental. It was looking through this data, although we are just focused on opioids, you know, we noticed that there was a real high number of youth overdosing all of a sudden, and thankfully not committing suicide, but attempting suicide. And we used that data and we worked with our partners at the mental health clinic in the FAST program to address that. We went out in public and talked on TV to parents about the issue of, you know, and they weren't overdosing on illicit substances, they were eliciting on whatever they could find at home. So the importance of storing medications that you have at home safely and locking them away is really important. And so again, through the overdose data that we collect and look at, we found other things, other causes, other issues that were not related to opioids, but we're not just going to put them away, right? So we talked to the right partners and alerted the community, and thankfully, knock on wood, since then we haven't seen that in youth anymore. So, so to your point, I can't tell you at this point, because we haven't made a plan yet, what exactly is going to be included in this comprehensive plan, but I'm pretty certain that the mental health component has to be in there because it's almost always involved with substance use as well.
And you, if I'm not mistaken, you are on a regular basis communicating with all three of the subcommittees through the Community Services Board.
Yes.
You present to the Mental Health Subcommittee to talk to them about the trends that you're seeing and maybe initiatives that can be done on their end. I mean, there is a good form of communication coming in regards to the work, and that would only just continue.
Yes, yes. And again, it depends on what we're seeing. So again, if trends go in a particular direction, then we can be flexible and address it. And if something else comes up, we can shift gears fairly easily and move into a different direction. But again, we need to have that basis of having that data and having access to all that information to be able to make those determinations. Otherwise, we'll never have a picture again of the whole countywide issue.
Keith and then Tim. Keith?
Yeah, thanks. And I thought the presentation was very good. And I have some very practical questions. I think they're practical, but let me kind of list those in maybe not order, but in some order. First is Monica, you made the implication or the statement that money would only be reimbursed as it's expended. And the question becomes the reimbursed to whom and expended by whom. So are you guys going to incorporate, because right now you're part of the county, you're part of the mental health department. So how does that work? It's the healing communities is not a separate organization, a separate 501c3 or a separate department in the county. So I don't understand how that will work. That's question number one. The question number two, let me say all my questions if I can, because I'll forget them. Forgive me. But question number two is that to confuse this with any kind of reduction in costs associated with 703 or foster care or whatever, I think is a huge mistake. If that's our focus, then that should be our study, to see what's the best way to reduce those costs. And that's not what we're talking about. I think what we're talking about is important in its own right, and it's not about dollars and cents. Exclusively, money's always an issue, but there are more important issues here that transcend money, and I think that's important to focus on. So that's a statement. But my other question here is this: it was my understanding from the beginning, and perhaps I was mistaken, but it was my understanding from the beginning that the study was intended to focus and apply, research validated responses to the local community, to our community in this case. That the study intended to do some research, see where we were, then to look at the responses that work other places, to look at applying those to our community, see what works locally, and then to incorporate those approaches in kind of our response culture in order to make sure those are institutionalized in the community. The mechanism that we have to do that, and by the way, the work of the Healing Communities Grant is phenomenal and is significant. But the process we have in New York State and in this community to make certain that we're institutionalizing this stuff is through the DCS and the Community Services Board. It's not to create another organization that kind of sounds like would receive money and then distribute money independent of that structure. So, one of my questions here is that why would we create another bureaucracy in order to do something that we're supposed to be doing right now? Why not give the Community Services Board or the DCS, if the issue is money, why not give the DCS more money to do this? So that's that question. My final question is, if we're not ready to move on, if we need to build on the work that's been done, then why not, instead of focusing on creating this new bureaucracy, to say the next phase of this needs to be a serious look at how we make certain through the existing structure of the DCS and the Community Services Board that we are able to provide the funding and the support that's necessary to accomplish what we need to be accomplished. Why do we need to create a new or maintain a new bureaucracy? I really, and this leads to this, is the idea that we have the Healing Communities has its own advisory board. Well, that's what the Community Services Board should be. And if that's not adequate, then maybe the Community Services Board needs to have another committee, an advisory committee, a subgroup that looks at this. So I don't understand in the long run how this all fits into the larger treatment, the construct and process that we have in the county. I know that's a multi-function, but this is a little bit of stream of consciousness. Forgive me if that's the case, but those are kind of my questions.
Thanks, Keith. That's a lot to unpack.
Yeah, I know. I'm sorry.
So going back to your first question about how the reimbursement would work. Again, with other grants, or specifically with the healing grant, it has gone in a similar way where we had an amount of money available, but it was not given out all at once, but it was also based on reimbursement. So basically, if we had a budget, and if we didn't use the whole budget amount for the year, we wouldn't get it. It was really just based on the amounts that were spent. And so besides the staffing, which is fairly easy to plan out, all the other things for that second bucket there for the agencies, again, depending on what they come up with and what they, what the steering committee feels is worth funding, that would really drive that one bucket.
Yeah, no, and if I may, I do see that, and I acknowledge that. But my question becomes why would the advisory committee for the healing studies, which is part of the mental health department, which is part of the county at this point, be making that decision versus the DCS versus the Community Services Board? That's the part that makes sense to me, that we're creating another group we're going to give money to, and then that group is going to distribute money independent of the structure we already have in place. That's what I don't understand.
That's how it's working now.
I mean, that was the whole part of that healing studies, that community-driven approach that required that everything was locally driven by local stakeholders, by a local advisory board, and we really put people on that steering committee where it made sense, because we had all the sectors represented, anybody who at any point could interface with somebody with opioid use disorder that may or may not jive with the alcohol and substance use subcommittee, for instance. That's already in place, and that has, an established structure of how to attract talent and how to attract new members. This was trying a different approach of how you get the stakeholders together, get them to agree to something, and then actually oversee and coordinate those efforts for all the partners that are involved and for all the stakeholders that are providing services in the county.
I mean, Keith, in my mind, again, I'm trying to understand this staffing pattern, this whole initiative is out of the mental health clinic and as a direct report to the current DCS, as an effort of addressing one of those disability groups, substance use disorder, the substance use group. There's ongoing communication. I mean, to me, this is a request to continue to fund the initiative that's directly integrated into the mental health system. And it's not part of the mental health clinic, but it is a direct report to the current DCS and part of the structure. to address the disability group of substance use disorder.
So your understanding is that the DCS and the Community Services Board would make the decision and not the advisory committee for healing? That's what I don't understand, Elaine.
You know, again, there is a steering committee for the Healing Community Study. How that will look after this initiative is over, I don't know. It could-
Well, that's an important question, is it not?
could easily
Maybe not,
trade-
maybe not. It's, that's okay. I belabored this enough. My confusion on this doesn't really count in for future decisions. I just don't quite understand the bureaucratic logistics, the process, the decision, how it's going to work. And it's probably not a discussion for today anyway, but it might be something that's good when the final proposal is prepared. It might be something that's good to clarify so that there's a certainty and clarity on how the money's going to flow. Money is always important. And if we're going to be distributing money, it's county money. It's important to know who makes that decision, how that decision is made, and so on. And that's kind of my question. But as I say, I think we belabored this enough, and forgive me if it was too much bureaucratic detail, my nature. Sorry.
Tim?
I mean, Keith brings up some good points. But I mean, I've been around government for a while and it moves kind of slow. Sometimes it goes in reverse. And the kids are not getting better because what's going on out there. But I would like to see a coordination between governments. I know the city got a large pot of this money. I would love to see them put some skin in the game and work with us. I would like to see.
There's been no formal request to the city of Auburn.
Yeah.
So this is how it could go. I think that Monica was talking about drawing down the money and how that would change. It's going to be based on what becomes available as time goes on. So I think if the county makes a commitment to do this, then we go talk to the other funders. So if the foundations kick in money, if the city kicks in money, it reduces the county's cost. It's very difficult to go to the city and ask them for anything because this really is legitimately a county gig. The local government unit, the mental hygiene system, that's the county's gig, and the city can say no, but the city's more likely to say yes if they see that there's skin in the game. So like if you made this allocation or any allocation in funding for this, and then the next bunch of months, it's going to be a lot of things are going to be changing. Money could come from a lot of places. We want to be transparent with the county. So there's where I think what she's talking about, where their commitment becomes less based on other funding that comes in. We're just not sure when it's going to land, how it's going to land. There is a lot of opportunity out there, but I think if we wait for that to happen, we're going to lose the momentum. We might lose some very talented staff people because they're looking at the clock and they got other gigs they can get. And we want to lock these folks up. I'm just never worked with a lot of really great people in my career, but I've never really had a team like this that was able to focus in this way and bring all of the experience and the expertise that they have to really move the needle. And more people are going to die. Like this trend is across the country and it isn't going to go away because COVID hasn't gone away and service providers are still a little shaky and people are still a little shaky in their lives. So that's really, there's what the reporting with the steering committee and the community services board comes in transparency with Health and Human Services to keep you guys apprised of how the money's looking, what's flowing, what's out there and all that. It'd be an ongoing sort of negotiation to do the work. So that's sort of the thinking of it anyhow, right? Does that kind of capture it, Monica?
Yes.
I mean, at this point, there is no resolution before us we have a resolution on the agenda tonight to see if we can get a commitment to use some ARP funds for this Housing Visions initiative to deal with our homelessness. The same form of a typical resolution would have to come forward after the first of the year to see if there would be county support to take some of the ARP funds and, to fund this gap funding proposal. And that would be the next step if we were going to move this forward. I just wanted the committee to take a listen to this, and if the committee has any ideas of what the next step should be, speak now.
Madam Chair, I'd love to see us maybe recommend this to the new board to go further with it. that a possibility tonight?
Yeah, I mean, there is no plan at this point to, like I said, there's no resolution. This would have to go forward next year. And, it would have to go forward in the form of a resolution, and perhaps when the new legislature comes on, maybe a similar project be in discussion for their comfort level. But, this is the beginning of seeing if the county is willing to make this investment and to use these funds. And she said there is certainly, it does fit in one of the buckets of ARP funds, the negative impact of COVID, and we could, certainly put it in that category. But that would be, this was step one in getting this on people's radar.
Well, I'd like to make a
Get something ready for the
Suggestion.
beginning of the year.
suggestion that we prepare for the first of the year.
How do people feel about that? Yes.
Obviously, there's probably a lot of questions that need to be asked. I don't personally have a problem with moving this to next year. Obviously, there's a need and further discussion has definitely got to obviously take place. I don't have a problem with moving on until next year and continue.
Considering it as an ARP fund project.
Yeah, I mean, obviously, there's room for discussion there and,
Yep.
and, I still think there's got to be some questions answered, and I truly believe that. I think Keith made a few good points. I'm certainly not an expert in all that matter, but, I'm willing to entertain, looking at this, further down the road, next month after. Obviously, I know there's, time goes on, people do what they do every day. I get that.
And I think, from my point of view, the hope would be that the county would make some kind of, if they're going to commitment to move in this direction, and that's the staffing patterns the staff would be looking at, is there any interest in this? So it would have to be soon after the first of the year.
Just if I may, ma'am. I know I asked this question and I don't think it got answered. Is there money that's possibly coming? Is it tobacco and opioid money both, or one or the other?
There is potentially, I heard 3 more settlements that might be on the way. I don't know that for sure.
From,
Opioid,
okay,
and those are the settlements we would be looking, the tobacco money, there's no, that's passed.
that's passed. Okay,
Yes.
so it's the opioid money that's possibly coming. We don't know how much or if, or even when it's going to
No,
arrive.
and, I think no one's, at this point committing that every opioid dollar would be put into this initiative. We feel that there are state and federal money also coming forward, but opioid would be one pot of money potentially. And like we talked about, Mark, at the last meeting, the one settlement, 1.4 million, that is over 18 years. So,
Right. It's not a lot of money.
yes, we'll see how the other ones go. And I don't think there's any additional information on that. Okay.
Thank you.
But I'd like to see in the future, a little coordination with the gift with the city, see whether that,
So that's something we looked at also.
see if we can maybe reach across the aisle on that with the city to see if we can.
City's part of the
that
county.
money.
Well, and just,
Very giving.
regarding that point, I mean, short of money, we're working really closely with Auburn Police Department. And as you know, a lot of the overdoses are happening in and around Auburn. So a lot of the data that we rely on and that we build on is based on the data that we receive from the Auburn Police Department. And they're doing some extra work of analyzing some of the data, literally going through 911 reports and getting additional information out there that again helps us make decisions.
We would not have to educate them on the problem. We would not have to educate them on the problem. They're seeing. it
Yeah, so,
firsthand.
and police chief is on our steering committee as well, so, so the city is involved in that.
Data collection.
All right, thank you very much.
Thank you.
All right. Now we have the fun part, the resolutions. Maybe we could get through those, and then if there's any additional questions on some of the reports. I saw Brenda, I think Brenda is on. Tonight we have I believe 15 resolutions. The first 4 are from the Office for the Aging. And if we can go over those all together and then maybe get a motion and any questions after that. But the first one, HH1, is to authorize the chair and the director of the Office for Aging to sign contracts with various subcontractors for aging services. And these contracts are supported with Office for the Aging funding. They are approved in the 2021 budget. And if we pass this resolution, we had a similar one last year at the beginning of the year. It would continue to fund and allow the contracts to go forward.
Madam Chair, before we get into resolutions, I just want to say that it's been a real joy to be on this committee with such learned people as yourself. And, you know, I hope in my absence that you continue in good stead and make this community healthier.
I'll make you proud, Tim. Okay.
Thank you, Madam Chair.
Yeah, thank
I
you.
just wanted to get that in before I leave
Max, put it on.
where the air is very thin up. on
Thank you,
6
Tim,
months.
seriously. HH2 is to authorize a contract with Arise for the installation of aluminum ramps for senior citizens. I had some questions with Brenda. She is gonna be using this unmet need fund that she got the $75,000 of funding for. And it will cover the costs of the materials, and it will cover the storage unit that I think she's worked in cooperation with the Sheriff's Department. And if this goes forward, this will be a ramp program for people over 60 who are in need of such services. HH3 is to enter into a contract with Cayuga to produce and mail the quarterly senior news letter. This is a recurring contract, if I'm not mistaken. And HH4 is to enter into a contract with the Community Health Network for expanding COVID-19 vaccination and assistance, giving them $11,062 under a contract with OFA to assist seniors in receiving COVID vaccine, registering for vaccine clinics, whatever. So if I could get a motion. For
Yeah, I move to bundle HH1, 2, 3, and 4.
Great. And can I get a second for those?
I'll second it, Mark.
Okay. Any questions for Brenda or myself, or Brenda, do you have anything to add to those resolutions?
No, I think they're pretty straightforward. Thank you.
All right, all in favor?
Aye.
All right, any
Aye.
opposed? Okay, great.
Thank you.
There are 2 resolutions for the health department. One is to renew HH5, we'll go through those. HH5 and HH15 was a late add-on. One is to enter into a contract with Finger Lakes Dog Protection Agency to do the work around rabies. This has been an ongoing contract. My understanding, I think, Kathleen, is the rates haven't changed since 2012, and what I read. Yes.
It's not easy work.
Yeah, exactly. And then there is also HH15, and that came late in the day today, asking for another 15 vaccine clinic support positions. These would be part-time, and we have funding, COVID funding to offset the cost of those. And if I understood you correctly, Kathleen, what you said is that you had the 15 we gave you in October. You certainly have a lot of interest, and there are more interest than there are positions. And this would give you the bench depth you need to have those clinics.
Correct. And I'm not certain we would necessarily fill all 15, but we do have some people waiting to work in these positions. It would be very helpful to have additional ones.
So you would have a list, a line list of people that you would call to say you want to work 3 hours for these clinics, and yes, that's how it would work.
Yes.
Okay.
Madam Chair,
Yeah.
I don't know if this is time to ask questions.
Can we get a motion and And,
approve it and then for discussion?
yep.
Correct, thank you.
Move HH5 and then HH15. Can I get a motion for those? All right, a second. Now discussion.
Kathleen, so I want to make sure I understand this correct. We already have the 15 part-time positions, and
Correct.
this is an additional 15 folks?
It is, yes.
And and we have, the county has the funds currently to support those extra 15.
We do, and it's pay as you go. So we're not paying you if you don't work.
Right, right.
So we do
Understand.
have the money in grant funding for COVID response and clinic.
And this is strictly for vaccine, or is there contact tracing with these 15 extras, or what? How's
These
that work?
particular people only work at the clinic. We have people who work contact tracing. We contract out with the Cayuga Community Health Network for their support.
Thank you for that.
And these are the non-clinical supports that you need. They don't give
Correct.
injections or pull up syringes.
Yes, they're the greeters. They work on the computers. They enter the data. They give you your card. That's those people. Scan your insurance.
Thank you.
Any other questions on that?
I have another question after.
Okay, can we vote on HH5 and HH15? All in favor?
Aye.
I,
All right, all opposed. Go ahead.
Why Kathleen said?
Yeah.
I know that Senator Schumer was on screen indicating that home test kits, do we have those in the county that we can disperse?
We don't have them dispersed to the public. So home test kits can be gotten at pharmacies. Some people order them off online work like Amazon. We do have that we receive from the feds to the state, to the locality. Some, they are the same brand as home test kits, but they're not meant for use at home. They're meant to be performed by a clinician on a person, and we use those in our schools right now.
So they're in schools.
Correct, yes. Binax antigen tests are used at schools currently.
And you are going to be starting symptomatic testing, working with the MO, I saw.
Yeah,
And
that's really, we're pleased that we had a pilot run on that Saturday at Finger Lakes Mall, working with Emergency Management Office to help staff it and administer. We hope at one point to entirely give that responsibility back over to EMO. They really did a lot of our testing, you know, back when we had support from the state to do so, and they coordinated it all. And also Quadrant Bioscience is the entity. Quadrant Bioscience does saliva-based testing. And so it's their materials, and they will analyze it. We need to facilitate it, find people to operate it, and get the specimens to the laboratory.
And the turnaround is,
It's within 24 hours, sometimes less.
Madam Chair.
Yep.
In regards to the EMO folks, and you say you want to turn this program back over to the EMO office now. Currently, we only have 3 folks that work there full time. Are they going to be able to handle this issue, or
No.
where?
So I said EMO office, but I suppose it's the emergency medical services and the EMTs that fall under the EMO umbrella. So David Newark in particular, Dale and David, we're helping facilitate to start with, and we hope that there'll be some additional EMTs who work within the county who will be interested in working as the specimen collection agents and administrators on site at the clinic. So there are some EMT jobs available. We can pay them through the funding the health department has. We can pay the EMTs to collect the specimens. Dave will schedule the clinics and transport the specimens to the laboratory.
and Aileen might be on too, but wasn't there an emergency resolution recently passed that'll be coming up at the ledge meeting, Mark, it'll be on the agenda. There was an emergency resolution that was passed allowing for EMO to bring on some additional staff to help with this work,
Correct.
part-time, similar to the vaccine assisters, or is that?
Correct. So if there's some volunteer EMTs, even if there's other EMTs who work for another company, because it is so very part-time, we'd like to hire them on. It covers them for liability purposes and pays them for their talents, and they can perform the specimen collection for us.
I know this was discussed at a battalion meeting. Fortunately, I couldn't attend it because I was here at another meeting. So I just would like, I'll have to do some more digging and get some more. I did have somebody ask me about, why the EMO was getting involved in the COVID thing.
So I'm sorry, I didn't mean to interrupt.
No, go ahead.
Well, and they helped operate the testing. We didn't have
Yes.
personnel to do that.
I'm.
And they had, and the authorizations of, I forget, the duties, of their licensure, of their certification allows for that to happen because it is very specific who can collect those specimens, EMTs being among them.
Right.
So that was the route that we thought was the most helpful.
Thank you.
And
And
you know
the-
how to wear the PPE and stuff too.
And the emergency resolution that just passed was to fill 10 COVID-19 emergency management service representative positions in the EMO department to help with this, I think, with this initiative.
Correct.
And I don't think without the support of EMO, the health department does not have capacity to do the vaccines as well as the testing. And there was a lot of people in this community very concerned that there was no access to symptomatic testing.
Correct. I think that's something, this has kind of been a long time in the making because it's surprising how challenging it can be to set this up. And sometimes it's the materials and sometimes it's the human resources and sometimes it's both. We're so pleased that right now we have this chance. We actually did use some of our contract nurses on Saturday when we did the pilot, but we also used some EMO people. So as we worked out the kinks, because there's a lot of online registration that needs to be done. So that kind of is what we were working out. It really is a great resource. The hospital had been asking us for months to find a way to stand up additional testing. The urgent care centers are just get overwhelmed with the number of people who need to get tested. Resources run low, the turnaround time is not as fast. So this is one more resource we can bring. We also had the opportunity to answer the survey that the state had asked us just before Thanksgiving. And additional testing support is something that we're asking of the state if they're able to help provide that on a routine basis that people can count on to be able to access.
Because I know the hospital was saying, look, there are people who want to know their COVID status. They don't really need a full expensive physical exam in our urgent care. They just want to be tested. And there was no other place really at times.
Or if you needed a PCR test, and that's what this says.
Yeah.
So then the intent, so if there could be travel related things, but this is really meant for anyone,
Sick.
right? You can come and have, your kid could have been asked to go home from school and you want to have them tested so
Right.
that they can return. That's a great opportunity.
So I'm hopeful
Yeah.
that, a clinic could be, manned or staffed to be able to have folks come in and just get a test.
Exactly.
Yep, and this would be for people who are symptomatic and need one, but don't really need to be
Correct.
examined by a doctor. They're not that ill.
Outstanding. I hope that program.
Yeah.
I see the need.
I hope we can get it to flow. I think we're getting there. We're going to do another small test, operate again on Wednesday. So if we'd like to kind of have those dates. So, spread the word.
I
There's
did read it
opportunity.
today.
That's great.
Thank you.
And is East Hill as a partner, are they doing Monday through Friday, the 3 to 4 p.m. drop-in
East Hill.
test as well?
They are offering, it's a slightly different type of a test. It's not the PCR based one,
Right.
but it is another great opportunity for testing availability and regular access.
Is
that
it
there's,
symptomatic testing or asymptomatic testing?
I should know this and it's been I'll have to find out, but I will let you know because it's
Okay.
important. It is important for people to know that.
Right.
Thank you.
Did we vote on these, Matt?
No.
Yes. Okay, can we vote on HH 5 and 15? All in favor?
Aye.
Okay, good. Okay, now we have some human services resolutions. If you don't mind, maybe I could just go over HH 9 and then, Christine can just quickly go through 6, 7, 8, and then 10. But HH 9 is allowing the chair to sign a contract with Housing Vision Consultants Inc. to complete funding application to expand the shelter beds in Cayuga County. And this would be using up to $250,000 of ARP funds. This is a follow-up to the presentation that Chris Travisani presented here as a way of looking at getting the legwork and the pre-development work done so that Housing Visions, who's got a great reputation and a good working relationship with the city of Auburn, can submit a proposal for the expansion of shelter beds at the Grand Ave site in Auburn. If I'm not mistaken, if the plan goes forward, it would be 50 shelter beds and 30 transitional housing opportunities as well, expanding the current location that's already been approved by the city of Auburn. Had some discussions with Lynn, and I think Rich helped with draft this resolution, and this going forward with a contract for Housing Visions. The county will contract with them to get this completed, the work completed, and there's significant work to be done. It says pre-development work is required in order to move the plan forward, including appraisals, environmental reviews, surveys, and architectural design. And all of this has to be done so that the funding opportunities can be pursued. I think this is probably the most exciting opportunity we've had. You know, it may take a year or more or two to come to fruition, but we should, this is some real good opportunities to try to eventually reduce the hotel space and the placements in hotels that we've been forced to do. And I personally want to thank Trish, because I don't know if this initial conversation started with you talking to Housing Visions and the city of Auburn around veterans needs, or however it initiated, but I think Chris went during his proposal here said it was crystal clear that this was the biggest priority that this county was facing. And, I think he's very excited about, the ability to get this funded and move forward. So for what you've done, Trish, I appreciate it. And thank you for that too. So if I could get a motion for HH9 for contract with Housing Visions, I'll accept one. Second,
I'll second it.
okay, questions?
But again, this is probably an outstanding program. My only issue would be, obviously there's some city folks that obviously participate in this. Is the city itself gonna, shell out any money from their ARPA windfall or not?
My understanding is they have been in discussion with the city of Auburn, and there's some reference to that here in the resolution. And they're looking at dedicating CBGD funds, their community development block grant funds, to this initiative. I don't have any, updated information, but it's my opinion that they are, in support of and willing to do some level of funding to address this. But I do maintain, yes, it is a city of Auburn issue because the hotels that are being occupied, but this clearly is a Cayuga County responsibility to shelter these individuals. And it is clearly a Cayuga County responsibility to pay those costs. I think 71% of those shelter costs for single adults is coming out of the county's budget. So I do understand your point of view. I do think that, they are in support of making funds available to move this forward. And, this will be, the request is this 250 be the county's contribution as well.
Hopefully they'll match the fund. That would be very nice of them.
Now, I'm not telling you they'll match $250,000, but,
Paying out
it
the
will, they're paying in their, as taxpayers, I'm a city of Auburn resident, I'm paying the shelter reimbursement as well in my county taxes. So it is a big deal, and I think it's pretty exciting to have some opportunities for this.
Chair, I was on the planning board when we had community housing for handicap in neighborhoods, and they've, we had a lot of resistance to those back in the day. But they've worked out pretty well. I don't think there's been any major upheaval. They fit in a lot better. I just want to make sure that you know, one of the gateways of the city of Auburn is Grand Ave. There's 32,000 cars that pass by there. And I want to make sure that any project that's on that street, that it doesn't be a detriment to maybe future investments in the city. I have no problem with housing these unfortunate. And
This is, it is zoned for it, but make sure that it doesn't
yeah.
impact
I hope that,
it's part of the pre-design work, I think, right?
What's that?
Part of the architect and design is to put a building up that meets code.
Yeah, there's a
And-
current shelter there now. It's
Yeah.
really expanding its capacity.
well,
Tastefully done. All right, all in favor for this resolution? Oh, Trish, you want to say something?
Yeah, I guess I just want to say, I just want to acknowledge that there's been a lot of partners involved in this, and a lot of county staff involved in the homeless housing issue and coming up with solutions. And I think it was right after I first came on the legislature where we formed kind of a subgroup off of Health and Human Services to start looking at this with the other partners. So I just want to say thank you to Ray and his staff specifically, because I know that they're the ones that are on the front lines working with this population. But I also think, just to address Tim's comment, that anything that's designed is still going to need to go through the city approvals. And I do believe that will be a dramatic improvement even to what's there now, with the investment that is being looked at. So I just wanted to acknowledge that. And I'm glad that we see this on the agenda tonight.
All right, any,
Yep, we've got a motion in a second.
all
Just
right,
need-
all in favor of HH9?
Aye.
Aye.
I
Opposed? Great, thanks. Okay, Christine, would you mind going over together HH 6, 7, 8, and then talk about HH 10, and then we'll get a motion for those four all at once.
So HH 6 is related to an opportunity that we had to receive some federal funding from the Administration of Community Living, about almost $19,500 to be used for adult protective services, situations that have are related to COVID-19. So we were able to choose from a number of options of how we wanted to use the funds, and we chose we chose 3 different points that we were able to choose. Providing goods and services to EPS clients related to COVID-19, related to home care, food, personal hygiene, over-the-counter medication. That's definitely a need that we see with clients in EPS, in particular, the folks that are in the hotels that are not able to move out. There's not a lot of the housing stock moving, so helping them have what they need when they're in the hotels, we need some of this money to help with those things. The second point was acquiring personal protective equipment and supplies, including costs associated with related cleanup and sanitation services for adults to return safely to their home environments. We have had a number of cases in adult protective where people have been in their homes, but they have not had a lot of folks coming over to visit with them and help take care of them that they did before COVID-19. And we've had some pretty sad situations where things got kind of out of control as far as like housekeeping. And so having someone come in to help, clean things up, keep things caught up to a safe level is something that we definitely think that we could use these funds for as well. And the third thing is for assisting EPS clients with securing the least restrictive option for emergency or alternative housing and obtaining, providing, or coordinating with care transitions as appropriate. So this one, we would be able to use some of these funds to help move folks into housing as we find it. We could also pay for some housing if we need to at a hotel. Okay, yep. Well, that's HH 6. H87 is to an extended contract that we have with Aurora Services of Central New York. We use them for interpreting services for folks that are hearing impaired, deaf, and we actually use them quite a bit with families that we have. We also work with blind and sight impaired individuals as well. It said on the resolution that the rates were attached. They told me that they actually do come to everyone, so I can answer the questions if you have questions about the rate. It's about $65 an hour, or if it's a 2-hour window, it's about $110 an hour. Pretty reasonable, I think, for what we get from them.
But required to, you have to have a way to.
Oh, absolutely. So yes, these services, thank you. These services are required by, ADA. If we have a disability, a person that identifies with a disability, we're obligated to provide them with a reasonable accommodation. And this is something that is an accommodation. HH8 is to fill a human services examiner's position in the Medicaid unit. We had someone in the Medicaid unit examiner give notice to leave. They took a job with the state.
Filling a vacancy is budget, correct?
Correct. Filling a vacancy that's budgeted. And HH10 is related to filling a senior typist position in the child support enforcement unit due to a reclassification that happened. That's in that unit right now. And when the reclassification study was completed by the worker and submitted to civil service, they took a look at the responsibilities that this particular employee has and said that it falls in line with a senior typist work duties rather than the clerk position that she's currently holding.
Can I get a motion for 6, 7, 8, and 10?
I'll move to motion, or to bundle 6, 7, 8, 10.
And then Tim second. Okay, any questions?
Yeah. Our workforce is intact, or there's a lot of people leaving, isn't it?
Yeah,
Got a lot of vacancies?
yes. We have people leaving, pretty much. We have had a resignation or more every week. We have a lot of folks in the services area. We have caseworker positions that are open, people that are moving on, people that are relocating for various reasons. People are relocating, people are taking other jobs. So we're a bit, I would say that we're not in a bit of a crisis, we're in quite a crisis there with maintaining staff and continuing to get the work done. Not so much in the temporary assistance area, but definitely, this one particular human services examiner in the Medicaid unit.
Is it because of the pay grade?
I think probably somewhat that, the conversations that we've had with people doing exit interviews has been that they're leaving. They feel that the benefits that the state has are better benefits. They feel that they can't pass up the pay increase. So it's definitely not all of them that are saying that, but there's a good majority of them.
But when somebody vacates, the workload shifts over to the existing.
Yes, and it takes a long time to train staff, to get them into training, to get them, able to perform their work duties. So yes, the burden of the work does fall on the current employees that are still here. And we've been, trying to get creative with shuffling things. We have supervisory staff that don't normally take caseloads that are actually carrying caseloads and trying to do some of that work, shifting the supervision up to, the higher level management folks in those areas of the department. So we're kind of doing everything we can to try to manage. And in services in particular, I don't think that we're going to probably see the light at the end of the tunnel for, if 6 months, 8 months to get all these folks in, get them trained and have them
At
stabilized.
one point, I know you got 3 or 4 vacancies or 5, and then I thought there was going to be some discussion around turnover, and then I heard, well, gee, we got 22 people on the list, and that felt a little bit better.
Yeah.
And so you do have a better pool to draw from, but you just got to get them on board and trained.
So, yeah, so I remember that conversation we had with you, and I think that we have been surprised that so many people have been still coming to the table. I don't know if that's going to continue.
Yeah.
I think that, we were fortunate and we're in a little bit better shape than some counties that were having trouble with even bringing on staff. They just didn't have anybody that wanted to take the positions. We have a continuous recruitment situation with civil service that we have where people can apply all the time and have their test scheduled very quickly, and then, have that graded, and then those folks are in the mix for us. Not every county chooses to do that. So I think that has helped us to maintain a pool of folks in caseworkers. So yeah, it's definitely, it feels different around our staffing, a little more shaky. Definitely more shaky than I would like it to be, but different than it has been historically.
I mean, the cost of training.
Yeah.
Retaining those people.
Yep.
Very important. Isn't it?
Yes.
You have other questions? Okay, where are we now? Motion second.
We have, we have a motion and a second. Just need to vote on this
Okay,
bundle.
all in favor of 6, 7, 8, and 10?
Fine.
Opposed? Okay, great. Thank you, Christine. Okay, mental health, their HH 13 was full. So we look at HH 11, which is authorize the chair and the director of community services to enter into a contract for mental health counseling. My understanding is there was a recent resignation of a current contractor, and we're requesting to fill, and obviously have money in the 2022 budget. Once you fill it, to extend it through. Okay. HH 12 is authorized the filling of a position at, I'm gonna have you do 12. Maybe we'll go to HH 11, and we'll do 14, authorizing the transfer. Okay, you might as well do all of this, might as well do the rest, because the general fund one really is to make your budget whole from the expenses.
Right.
Yes,
Yes.
okay, all right.
Can you guys on the?
Can we get a motion for 11 and a second, HH 11, which is contract for the mental health counselor? Yep, second,
I do.
okay. All in favor? Aye. Any opposed? Okay, great. And then if you could do 12, Ray, and then we'll go to 14.
Right, so 12, the deputy director submitted her resignation a couple of weeks ago, and her last day is Thursday. She got a great job offer at Syracuse University, and they want her now. So I'd like to fill that position. It's budgeted. It's a really important position. We're sort of down senior level people there. The fire director is out on maternity leave to the beginning of January. It also gives me the opportunity to sort of do another reorganization of duties and perhaps save some money, and I'll be able to report a little bit about that later. But I mean, that position supervises care management. There's no one supervising that. It has a lot of other responsibility in the organization. So the job's been posted, and resumes and applications are going to civil service.
The deputy director job is posted for an anticipated opening, and you're having interest from within.
Yeah, we've got some internal candidates that are really strong. Gives an opportunity for people to move up.
And then okay, can we get a motion and a second for this, and we'll have some discussion? Move it. Second, okay. I know, Ray, there had been, I think, one question, I think Trish might have raised it, coming forward about being this close to having a new DCS, why the need to move this and not let the new DCS hire? I mean, at this point, because you do have an internal candidate.
Well, I mean, I'm the most familiar with the department. I understand it, the best. I have an idea about what that job does. Why would you wait for a candidate who you even know who it is and might not even start on time? You need to have some orderly transition in the department. This is a key position to be vacant.
And it is true that we'll be doing the interviews, and there currently is only one internal candidate for DCS.
That's
So
what I hear. No,
there could be that somebody from the outside would be.
I don't know. Yeah, anything could happen. Or no one gets selected. And then you're gonna have a situation where you need an interim and you need a deputy director for that.
Mark?
So I'm trying to wrap my head around this. Obviously, position is posted. And there's already opening.
Anticipated opening.
Okay, so there's obviously some time frame that has to take place for the job to be advertised for a certain amount of days. then, you know, obviously there's got to be some interviews by a committee, or is it strictly your decision?
So the leadership team typically there has interviewed the deputy directors in the past. So there's a team of senior level people that run the place. So they would be part of the interview process as well. Yeah, it's a department hire.
The deputy director is not a legislative appointment like the DCS, yes.
But I'm strictly looking at the HR department, you know, following their guidelines and all
Yeah.
that. And so you're talking about putting this position in play prior to the first of the year and you leaving.
Well, I think we want to fill the position. You never know what the timing is. I'm not leaving until the end of
When
January.
is she leaving, right?
Hmm?
When is?
Thursday.
Oh, this deputy director, it gave a very short notice. She's leaving her job here on Thursday. Is that,
Yeah, she's done. So it's a routine resolution, really. filling the position.
any questions about that or concerns? Okay, all in favor?
Thank you.
Okay,
I'm opposed.
you're opposed to filling the,
Yes. Should do, you know, I mean, our legislator's gonna be done on the 14th of this month. It won't come in front of the, I mean, I understand it's not a legislative appointment. However, I mean, we're at, you know, we're at the middle of the month. Year's over and
but
at the end of the month.
likely though, the name of the deputy that would be appointed would not even come forward for legislative consideration or vote.
Right.
It means,
It's a department hire.
Despite the time of year, it's a routine vacancy resolution to fill.
That's fine. I personally oppose it.
okay,
That's all.
that's fine, that's fine.
Does that pass?
Trish, me, Tim, Heidi, yes.
Okay, thank you. The last one is, so in the department, so there's two lines in the department budget. One is for family court psychiatric assessments of competency, which we've never done one of those in the 10 years that I've been here, but we did one recently. So if you look at the resolution, it's looking to put $26,000 in that line. We have a kid that's in a facility right now being restored to competency. And then we do I appoint a psychiatrist to do 730 evaluations, which are, it's a criminal procedure law thing that determining whether somebody's competent to participate in their defense and all of that. So those evaluations sometimes indicate that a person needs to be placed in a forensic hospital to be restored. We've had this year the most 730s that we've ever had to perform. We had a couple, 3 people in psychiatric hospitals, and there was $60,000 in the mental health budget, and we're going to go over budget. So this is a budget to move money from the general fund into the department to be able to pay those expenses.
And if I'm not mistaken, the, even if we didn't particularly do this, at the end of the year, we would have to make this payment. whole.
Yeah.
But this was a way to illustrate that, you know, these are additional monies that are becoming the county's requirement to pay because the withdrawal of the state funding. And it
Yes,
does
it-
have an impact on the county's budget. And that's just illustrating that, you know, we are going to have to take money out of fund balance to meet this commitment.
Right, the state used to pay 50% of these costs, but a couple of years ago in the budget, they changed that in the budget language to make counties 100% responsible for it.
Right?
And as I recall from 2022 budget discussions, these items occur now in the 22 going forward. We know that.
Separating them out so
Remember.
you could track them, yes,
Right.
that's right. I think that's a good plan.
And you budgeted for some of these
We
expenses.
put the same amount, and I think that was the instructions that we had, was to put $60,000.
Because you don't know.
We don't know, it could be zero, it's been
Right.
zero before.
Right.
Certainly.
So I just want to be clear. This is this above and beyond what you budgeted for 2022 or not?
Yes,
So it's above what you budgeted for 2022.
right, no, 2021.
By
And my question is this above and beyond the 2022 budget request?
Yes,
And I questioned that too. And I thought the answer was, well, if you know you had these expenses in 21, why would you not put them in for the 22 budget? And the answer was, you're not totally sure what the
there's
expense
no one,
will
there's
be.
no one in a forensic site state
So
now.
why would you put it, put it on the tax roll until you know, but
Well, but this was also the instructions that we got during the budget preparation was to budget it the same that we budgeted in the past, so that's what we did.
Okay, I understand if you
Yeah.
budgeted for 2021 and you budgeted the same for 2022. Okay, my question is this resolution above and beyond the 2022 ask, and you're saying it is?
Yes,
I don't get that. I'm a little confused on that.
Because we're in the 21 year that he's referring to.
Do we have to make 21 whole?
yes.
Right,
This,
through unrestricted funds.
well, you know right now before the end of the year closes, you don't have enough
I don't have
money
any more
in this
expenses.
account.
Right. we don't-
So in order to cover the bills that you have
In
right
21.
now, you gotta take money
In
in
21,
21 to cover your expenses. And that's what this resolution is doing, putting money in your budget to pay the mandatory costs.
You've already incurred.
We've incurred it.
Yep, and the point was, let's illustrate that this does have a local impact on Cayuga County. Because, we're falling short because a year ago or more, the state paid half of the cost for these.
Yes.
And now they're 100% local, and look at the impact that it's had. We had to take money. I mean, that's the reason we're doing it
Right.
at this point.
So, Mark, these expenses don't go into 2022. These are stays that have already occurred and the people have been released. So there's no more bills past this. Every year that I've been here, we budgeted $60,000 in the 730 account and $10,000 in the 502 account. And we've never gone over before. In some years, it's zero. So it's kind of an anomaly. I think there's a strategy to manage it. I think what Keith wanted to do in the budget, and and Elaine in those conversations was keep it the same in 2022. And then if you go over, bring it to the legislature so they can see what it's at. So that's the reason why it's staying the same. There would be no way to predict what it's going to be. It could be zero. There might not be anybody going to a forensic hospital in 2022 in Cayuga County, and then you won't spend any of it. Does that make sense, kind of?
I'm still a little foggy, but that's normal for me.
So I'm
So I
happy to
guess,
talk-
I guess what and again, I'm just trying to understand. So is this just asking so that if we fall short in the budget ask for 2022, this just gives us permission to have whoever come back to the ledge
No,
and ask for money?
I mean, the way I look at it, Mark, this resolution is taking money for 2021. We know we're over, he knows he's over what he budgeted for. In order for him to pay the bills, he's got to get money from the fund balance to make these lines whole. So if we don't transfer this additional money into these two lines, he technically wouldn't be able, out of his budget, to
Yeah,
pay
the
those
department
costs.
wouldn't be able to pay the bill.
So, yeah, this just allows him to pay the bill and show we didn't budget it. There's a shortfall now because of the impact this has on the county.
Right. It's impossible to predict in a given year how many of these will happen.
I get that.
Yeah, it's a really dicey kind of thing. There is some talk with the legislature, the New York State Legislature, about restoring the other 50% of this, because I think they're realizing that it's really hard on counties to pay this money, and it really is a state cost when you get right down to it.
So
Okay,
another question is, just so I can have clarity about the 2021 budget as we come close to the end of the year, we're at December, what is it, 4th or 5th or something. When you were doing some budget presentations last week, there looked like the potential for about a $400,000 shortfall. and you thought that by the end of the year, that really wouldn't be the case. At the end of the year, we're talking 20 days, that you'd be able to make that up. What does that really look like now? We know the 128 is in there.
No, that was your clinic shortfall.
Yeah, I have to take a look. So so Carol generates the reports when Munis closes by the month. And then our billing, so we won't know by the end of the year because the billing, the Medicaid billing and the insurance billing for 2021, sessions and all of that comes into 2022. So we end up tracking that, and then we have money that we're able to move into the budget, so we end up making it whole wherever it is. So if it gets down to, she says to me, we need a couple $100,000, we move that from the reserve account that we've established to make it whole. So it's just figuring out where so it has a lot to do with when Munis cuts off, when the county tells us, the claiming ends and all of that. And then we work it out usually January, February.
And so that reserve account is not our general county's reserve, it's
No.
mental health. reserve.
It's surpluses that we generated that are restricted by the CFR, so we can move it in for expenses when we need to. So I just like to sort of see where we are.
But the 400 she's referring to, or the deficit that you were asked, has to do with your clinic operation.
It's an operation of the department.
This is outside.
It's
Yeah.
nothing to do with it.
Yeah.
But in that-
I realize that, I just wanted to.
Oh, okay.
But in that amount of money is also, that includes the retiree health benefits as well, so it's kind of, that seems bigger than it is. But we usually, every year, we zero it out in some way or another. Massaging. This is I have one more meeting with you guys after this.
Oh, I'm sure. you
I'll bring pizza.
can. All right, now that you're making.
Oh, I'll make it at Angelo's before I come down. You guys have any other questions for me or anything? I know it's late right now.
No, Did we get a first and a second for that?
I actually, Elaine, I don't have,
Just
motion and
have a
second.
quick question, if that's okay.
If we just violated all the rules, can I get a motion and a second
There we
for HH 14?
I'm down move, HH 14.
And then, Tim, will you second?
Yeah.
Okay,
Is that
All right.
Is that a 2/3 vote, with the legislature to move money out of the, isn't it? Not move money out of fund balance.
oh, yes, it will be on the
When it
floor.
comes to,
It will be on the floor, take a 2/3 vote, because we're taking $128,000 from the fund balance. We're putting it in the mental health budget, because we have to pay the bill anyway. But yes, on the floor, the required
Yeah, I was
2/3
wondering.
vote. Yes, Trish, do you have a question?
Just a comment that, I don't know if this would normally occur, but I would love to see a copy of this, if it does pass, be sent to our state representatives with, some advocacy around this issue. I'm sure we are advocating, but, we need to continue to advocate, for this, because these costs are directly as a result of a shift in the costs from the state down to local government. So like you said, this clearly shows the impact, and if we do pass it, I would love to see that go forward to our state reps.
Okay, thank you.
Madam Chair.
Pardon?
Thank you. Ray, I guess just a request. Is this in any way possible to be put on paper so that, we can actually see the numbers? I mean, obviously you must have in your mind some number that we're in shortfall of. And because I'm assuming the 128,000 is what we're in shortfall of. Am I correct in that?
You want me to sort of give you some words about where we're at financially?
Well, just on paper, just because to me, I mean, I can get lost for me in conversation.
Sure.
Am I correct? I just want to make sure. Am I correct that right now we're trying to pass 128,000?
What we're trying to do, I believe, is we're trying to add money to these two budget lines in his budget. We're going to increase this line by 102,000. See that in the resolution? And we're going to increase the other line by 26,000. That will get you the 128,000 that he's short. We're putting money in those two budget lines so that it's available to pay the bill
Right.
when it comes.
So the top line in our budget has $10,000 on it.
Okay.
So it needs 26,000 more for that
What is the FC avails?
family court.
Okay.
So
family
this
court,
is a
yes.
juvenile that was found not competent and then was placed in a PWD facility for restoration, and that's the cost. There was, in the next line, for the psychs, we had $60,000 in that line, and we need another $102,000 to pay for the psychiatric stays for 3 people that were put there during the course of the year, moved from the jail to the state hospitals.
What's CML?
County mental,
County.
I don't know what that means.
Okay, all right.
It's mental hygiene, 730 restorations from forensic hospitals. I don't like what the initials mean that they have in there. I'm not really sure.
Is
But they're
this
sites.
I don't have the resolution, actual resolution
No.
in front of me.
Oh,
Is
yeah.
that
Right there.
in the resolution, you know, on my computer so that I can look at it?
See, that's,
So we have 10 in our 21 budget, there's $10,000 in this line. It needs 26,000 more to pay that bill for that kid. We have $60,000, and this is what they've done all the time that I've been here. This one has 60,000 in it, but we need another 102 to pay for the three placements that we had.
yeah, so when you see it, it looks like, yeah, we need 128,000, it's gonna go into those lines. So
Okay.
those bills can be paid.
And then it's gonna go to the Office of Mental Health. We'll get the check. And none of this is, like, you can't use any revenue that's generated by any mental health programs to pay these costs.
And this has to be a 2/3 vote on,
At the ledge
Ledge.
meeting, only because it's coming out of fund balance. Yep, so,
Don't feel bad, I mean, it's very complicated.
It
The budgeting of mental health stuff is very, very complicated and takes a long time to get used to it. And
and
even then, it still gets more complicated every time they change a rule.
if the year ended with this shortfall, there's this cleanup resolution at the end of the year that would allow the treasurer's office or whoever to make these payments.
Right.
But
Mark, the hospital had a problem with billing like Medicaid and Medicare. You know, do we bill the state and feds from your,
So we bill Medicaid, Medicare, and other third-party providers. We don't have a problem getting reimbursed.
but I'm just saying that you gotta be sophisticated. I mean, when we lose all these people, all those people who you have to put in the system.
Yep.
What that should be, you know, makes a difference as to whether or not we have to come up with money, so.
I mean, this, yeah. These
Yeah.
costs are totally outside of your
Right.
current operation, right?
Yeah, when I got here in 2012, the county had $1.7 million local share of the department. I think since 2014, you haven't had to put the nickel into county mental health.
The clinic operation.
The
not
department
man-
operations.
Yeah.
Sometimes we would cover the retiree health benefits and everything as well too. And then we were able to establish some surpluses, so we had ourselves a fund to be able to weather the ups and downs when stuff like that happens, because I mean, we lose a lot with COVID. We were talking, the visits are shorter because people can't, the connection goes, and
So your billings are down.
your billings are down this year, that's why it is, because you have a 45-minute session in the office, but they can only do 20 minutes on the phone or on the internet before it goes out, and then we got to bill, it's all based on minutes. So that's really
It's
good.
complicated.
Yeah, so, but we do a good job, and we do a good job over there, we really do, so.
And it'll be interesting.
That you have the right personnel entering that data.
It's
Oh, yeah.
going to be interesting going forward to see socially and in a macro way, if people stay comfortable with telemedicine and resist coming back in, which is a higher billable, and continue to, use telemedicine where, sometimes you can't engage as well. So you get a 20-minute session where
Right,
you do face-to-face rapport work, you do 45 easily.
right, or you get kicked off too, like people's internet
Right.
is pretty bad, and
Right.
our internet at the building was really bad for a long time ago, we had to spend a lot of money to get it upgraded, but yeah, those are the kinds of things that come up with people, and all kinds of stuff, but I think you're gonna see telemedicine. So we were able to provide it, that's the thing, but I think the phone calls, which is different, I think you're gonna see different rate structure to allow for those, because that has worked for people too, like you got folks at adult homes, in Moravia, They don't have to drive to the clinic anymore for their visit. They can get it on video or on the phone. It's just a lot more convenient for them. It's a lot less disruptive to their lives, so.
Okay,
But I'll bring pizza next time,
we'll hold you to it.
no doubt.
One
Not
question,
with olives on it, right, Rich?
no,
No black olives.
no. One question before you go. Evergreen and Leedsport used to house
Yep,
some of our, is that operational now? Where is it?
done.
They lost their license.
They lost it. Well, they didn't lose their license. There was a process for them to appeal DOH. They didn't do it. They elected not to.
It would have been helpful for us, because now we have to house those people.
They're all, the bottom are in the wind. There's actually, I think 3 of the residents went after they got moved, committed suicide.
Right,
You know, a couple other people died from loneliness. They're all over the place. There's some folks at Northbrook, there's people in Syracuse, Red Creek. DOH moved them all over. So they were there. I know in the paper, they talked about they were gonna get some mental health license to open. That's not gonna happen.
can we just vote on 18
Yeah.
and 14? Okay,
Sorry.
all in favor?
Aye.
I just
Okay.
wanted to touch.
But they were huge.
It's
They were
it's
huge.
important to our mental health. They have those operational,
They took people that no one else would. They really did. They did, and they did a good job.
and it saved us money.
Wow. And the quality of life for those folks. It was a lot better.
No,
So moved.
Right, okay,
Yep.
thanks. All right,
Nightingale second.
all right. Favor?
Tricky stuff.
Yes.
Aye.
Jody,
I got a new cell phone. It freaks me out.
maybe tomorrow?
Yeah, give me a call. I'm really busy.
Oh, yeah, I'll call you. Why don't you have
You guys are muted.